Students, in this session, we'll be discussing about nanotechnology in cancer diagnosis and therapy. Cancer, as you know, is one of the main causes of death worldwide, and according to WHO, the number of cancer related deaths is going to increase up to approximately 13.2 million people a year by 2030. So currently the cancer treatments rely on chemotherapy, radiotherapy and surgery. But unfortunately, these approaches are not specific. That is, they attack both the tumor and the healthy tissues as the same. So this causes adverse side effects to the really debilitated patients. Now, a branch of biotechnology, namely nanomedicine, has emerged as an innovative way to exploit nanomaterials for human health, including cancer treatment. The nanomedicine allows performing early diagnosis, curing with minimal side effects, and evaluating the efficiency of the treatments in a non-invasive way. So we are aware that what are nanoparticles are. Nanoparticles are colloidal systems, very small in size, which ranges in a size up to 1 to 100 nanometers. So generally a nanoparticle is known as so when its size is less than 100 nanometers. And the characteristic features of these nanoparticles are a high surface to volume ratio, their morphology, and the properties depend on the components of the preparation methodology also. These nanoparticles can be used as therapeutic agents, as drug carriers, or as contrast agents for imaging purposes. So, in cancer, we are using these nanoparticles either as a therapeutic agent or as a diagnostic agent. To be exploited in this biomedical applications, the nanomaterials must be biocompatible, well characterized, and stable in vivo. Now, the classification of the nanoparticles. The classification of nanoparticles here is based on the nature of these nanoparticles. So, the two major classifications are inorganic nanoparticles and organic nanoparticles. The inorganic nanoparticles, as you can see from these illustrations, we have nanoshells, silica nanoparticles, gold nanoparticles, quantum dots, nanoceria, iron oxide nanoparticles. And from the organic nanoparticles, the major one which are used for in vivo diagnostic or therapeutic purposes. We have micelles, liposomes, dendrimers, polymeric nanoparticles, and lipid nanoparticles. Now let's have an insight into each of these components a bit. Nanoshells. Nanoshells are spherical particles composed of a dielectric core, which is usually silica, surrounded by a thin layer of metal. This structure, that is a spherical structure with a dielectric core, makes them strongly resonate with light at specific wavelengths, and the resonance can be tuned in a large spectrum of wavelength by manipulating the shell thickness and the nanoparticle size. So they can either absorb or scatter light. The absorbing nanoshells are mainly used to generate hyperthermia. Hyperthermia is an increase in temperature. Now, there's a one general rule with the cancerous cells. The cancerous cells are extremely susceptible to an increase in temperature in comparison with that of a normal cells. So, for treatment, hypertherapia is one of the major methods for treatment of your cancer cell. So, these nanoshells can be applied over there to generate hyperthermia. Whereas nanoshells, which are scattering the wavelengths, are used as contrast reagents in your imaging purposes. Silica and gold nanoparticles. Now, silica nanoparticles have an easily tunable mesoporous structure and a high surface volume ratio that ensure a high loading capacity. High loading capacity, here we mean to that they can be used for loading the drugs, anti-cancer drugs, and a homogeneous distribution of drugs, or they can be used as imaging agents. The solid framework composed of the silicon and the oxygen bonds is extremely resistant to degradation or external stresses. Moreover, they offer a great advantage of having lower toxicity and higher biocompatibility compared to other metal oxides. Gold nanoparticles have unique, peculiar optical and electrical properties with a low toxicity and a higher potential. They can be used either as a nano tubes, nano robots, nano cages, right? The golden nanoparticles have been investigated as a delivery system for therapeutic agents in photodynamic therapy for the treatment of cancer, or they can be used in diagnosis to detect biomarkers of different kinds of diseases. The next major class of a nanoparticle, inorganic nanoparticle, quantum dots. Quantum dots, as we know, are a small class of nanoparticles which are very small, less than 50 nanometers in diameter, consisting of a semiconducting material with specific electronic and optical properties due to their high surface to volume ratio. The quantum dots can be synthesized with a core shell structure in order to block the size of the internal core to the desired radius. Fine. Moreover, if the shell is made up of a different semiconductor with a higher band gap, the quantum dots properties can be finely tuned. The quantum dots have high intense fluorescence, resistance to photobleaching, high sensitivity for detection, and thus they are exploited for imaging purposes. Liposomes. Now, these are a class of organic nanoparticles. Till now, we have been discussing about inorganic nanoparticles. These are belonging to the class of organic nanoparticles. Liposomes are made of phospholipids, lipids, and cholesterol. And due to their amphiphilic nature, phospholipids spontaneously self assemble in water, forming spherical structures in which the hydrophilic head faces towards the solvent and the hydrophobic tail forms from the lipid bilayer. Liposomes have one or more lipid bilayers, but they all enclose an aqueous core, mimicking the morphology of cell membranes, and they can encapsulate both hydrophilic and hydrophobic drugs. Usually, a outer layer of polyethylene glycol is often necessary to enhance their stability. PEC is known to provide steric stabilization, extended blood circulation, and reduce uptake from mononucleophagocyte system, the in vivo immune system. We have FDA approved drugs or formulations which are made up of liposomes already for chemotherapy. Doxil-VR, Myoset, and Donazome are some of the liposomal formulations which have been approved by the FDA for chemotherapy of cancer. The next class of organic nanoparticles is your polymerizomes. Now, these are morphologically analogous to the conventional liposomes, but they are composed of a synthetic amphiphilic block copolymer. An amphiphilic block copolymer consists of two or more blocks of different polymers linked together by covalent bonds. One of the blocks is hydrophilic polymer, usually PEG, and the other one can be any biocompatible polymer such as polylactic acid, polylacticoglycolic acid, polystyrene, or polycopropylolactone. The block copolymers can be designed to have specific properties in order to obtain nanoparticles with the desired features. So they can be designer made. The polymerizomes possess higher stability, higher mechanical resistance, and reduced permeability compared to liposomes. The other class of organic nanoparticles is micelles. Micelles are spherical aggregates made up of amphiphilic macromolecules where the hydrophilic part is facing the solvent while the hydrophobic tails are confined in the core. Polymer nanoparticles are either solid spheres or nanocapsules composed of biocompatible and biodegradable polymers such as polylactide, polylactide coglycide, and caprolactone. Natural polymers like chitosan, alginate, gelatin, and albumin can also be the major components of polymer nanoparticles. The quite interesting type of organic nanoparticle is your dendrimers. Dendrimers are a class of polymers characterized by a central core, an atom or group of atoms, and the multiple branches that end with several terminal functional groups. The branches extend symmetrically and radially from the core, forming an overall globular shape. The advantage of dendrimers is that their architecture can be controlled with high precision, giving rise to well defined and monodisperse objects. Hydrophilic or hydrophobic drugs can be incorporated into the core of the dendrimers depending on the nature of the monomers composing the macromolecule. The other class of organic nanoparticles, solid lipid nanoparticles. These are made up of lipids that are solids at temperature like your fatty acids, steroids, waxes, monoglycerides, diglycerides, or your triglycerides. Now let's continue with our discussion on the use of these nanoparticles which we have discussed till now for cancer diagnosis. We have seen a class of organic and inorganic nanoparticles, and now we'll see their application in cancer diagnosis in this session and later in another session about in cancer therapy. Cancer diagnosis, at present we are using the imaging techniques and the morphological analysis of the tissues, that is the histopathology, and which are allowing us to the diagnosis of the cancer, the imaging techniques and morphological analysis. So the most widely used imaging techniques are the MRI, computed tomography, endoscopy, and ultrasound. But by these conventional methods of cancer diagnosis suffer from a major setback. These are not able to diagnose the cancer at a very earlier stage. By the time we diagnose, thousands of cancer cells may have proliferated and even metastasized. So we resort to another method, which is your nanotechnology based diagnostic methods, which are being developed as a promising tools for real time, convenient, and cost effective cancer diagnosis and detection. The diagnosis of cancer with nanotechnology based methods, we can majorly classify the principle into screening of biomarkers and imaging of cancer. The screening of biomarkers are for diagnostic purpose, and they are also for the aiding the post diagnosis. That is, it can help us to stage and analyze the progression of the disease, determining what type of therapy has to be applied, and we can have a follow up of the patient. And for the imaging purpose, the imaging can be done either on the patient or on the biopsy specimens. So the two major principles of nanotechnology based cancer diagnosis involves screening of the biomarkers and imaging of the cancer cells. Now we are going to have a summary of the various organic and inorganic nanoparticles which are known to us and their application in your cancer diagnosis. We have discussed about these classes, the quantum dots, magnetic nanoparticles, gold nanoparticles, polymer dots, and the liposomes. Now, these molecules are undergoing certain modifications. The nanoparticles are functionalized either either by chemical modifications such as polyethylene glycosylation, antibody, or they can be tagged with fluorescent probes, aptamers, targeting peptides, or any other small molecules. And these are aimed at finding out the proteins or the DNA and RNA, the circulating lymphocytes, or the extracellular vesicles, which are the biomarkers of the cancer cells. The cancer biomarker acts as a measurable biological molecule that can be found in the blood and other tissues or body fluids such as saliva and urine, indicating that cancer exists in the body. These cancer biomolecules or can be proteins which are secreted proteins or cell surface proteins, carbohydrates or nucleic acids, that is the circulating tumor DNA and the microRNA that are secreted by the body or cancer cells when the cancer is present. Quantum dots, gold nanoparticles, and polymer dots are the three common nanoparticle probes used in the diagnosing cancer. So these cancer biomarkers such as the DNA, RNA, the secreted proteins, and the circulating lymphocytes by themselves, tumor lymphocytes, and the extracellular vesicles. These are the markers which we are going to diagnose, which we are going to detect in the cancer patients with the help of the nanoparticles. Now, this gives you a summary or the tabulation of the various nanoparticles and the probe which has been used on the nanoparticle and the specific ligand which they are target at and the type of cancer where they have been applied. So in the first case we see magnetic nanoparticles. The affinity probe is an antibody and the ligand to which it is targeted is the EpCAM. And the type of cancer which detects is a colon, liver, lung and breast cancer. Similarly, we have the few other classes, quantum dots, which the affinity probe being aptamer. Aptamer are nucleic acids, especially RNA, which can bind to a whole virus cell as such. They bind to specifically to proteins and sometimes even whole cells. So here, aptamer is affinity probe, which is targeted at a ligand of PTK7 and it can detect the cancer leukemia. So the remaining tabulations, we see that the application of the other nanoparticles such as polymer dots, golden nanoparticles, carbon nanotubes, nanorod assays, nanoparticle coated silicon bead, and the nanofibers, and the corresponding affinity probe and the ligand, and what type of cancer do they detect. So, after the finding of a cancer by means of the biomarkers, we can use the nanotechnology or the application of nanoparticles can be found in imaging techniques. Apart from diagnosis of cancer through detection of cancer cells and the biomarkers in the liquid biopsy samples, we can use these nanoparticles for identification of the cancerous tissues. So this has a potential advantage than the previous methodology. A proper nanoparticle probe for detecting cancer tissue should exhibit longer circulation type, be specific to the tumor tissue, and it should present low toxicity to nearby healthy tissue. The current related studies have focused on nanoparticle probe accumulation in tumor tissue for diagnosing cancer in animal models, which is generally the mouse models. So, nanoparticle probes can preferentially accumulate in tumor tissues through active or passive targeting, thereby allowing imaging and diagnosis of cancer in vivo. So, we should be now discussing what is the active or passive targeting. So, passive targeting. By definition, passive targeting represents the preferential extravision capacity of 10 to 150 nanometer nanoparticles from the bloodstream into the tumor tissue. Now, let me give you a small explanation over here. The rapidly dividing tumor tissues, as we know, the uncontrolled division progresses during the development of a tumor. So, during this uncontrolled differentiation, one major process, angiogenesis, occur. That is the formation of the newer blood vessels, but they are not organized properly in your newly divided cells. So what happens? This leads to the effect called as a EPR. Now, due to the defect in the formation of the new blood cells, the tight junctions between the endothelial cells in the new blood cells in tumors do not form properly, and the nanoparticles can preferentially accumulate in tumor tissue. This form of passive nanoparticle entry into the tumor microenvironment is called the enhanced permeability and retention effect. This effect was detected approximately 30 years ago by studying the macromolecule transport into tumor tissues. So this passive targeting can be the one of the principle for applying these nanoparticles for imaging purposes. The other methodology, the active targeting. Here, active targeting aims at programming the nanocarriers to target specific cells after extravasation. It relies on the molecular recognition, that is, the ligand receptor or antigen antibody interactions of the diseased cells through specific receptors that are overexpressed on them, but that are instead normally or minimally expressed on healthy cells. The ligand must have a high affinity for its receptor, and the interaction must be able to trigger receptor mediated endocytosis, after which the intracellular release can be favored by acidic pH or enzymes. In both of these active or passive targeting, the quantum dots represent the ideal tool for cancer imaging because of their unique absorption and emission spectra negligible photobleaching, and stable fluorescence. These quantum dots have been conjugated to streptavidin and IgG to detect extra and intracellular molecules and prove to be more photostable than conventional fluorophores. So there are a lot of studies, and in a recent study, polyethylene glycolated quantum dots were conjugated to anti-H2 antibody and localized in specific tumor cells. There are also pilot studies which are performed on primates which are demonstrated no evident toxicity of up to 90 days post injection. But further investigations are still necessary to clarify the persistence of heavy metals in the body. So we can see a study which was conducted in 2002, as early as 2002, which demonstrate the imaging of the cancer cells. The particular quantum dot injection is given into the intradermally through the into the and intravenous injection in the tail. Intravenous injection, I'm sorry, it's an intravenous injection into the where into the tail, which moves on and detects the cancerous tissue. In this particular image or picture, we can see the red quantum dot localizing a tumor tissue in a live mouse. And the next slide shows you the cell motility imaging. The green quantum dots filled with vesicles move towards the nucleus in breast tumor cells. Apart from the quantum dots, one characteristic and interesting development is the spions, that is, super paramagnetic iron oxide nanoparticles. These have been applied for cancer diagnosis due to the intrinsic magnetism and the possibility to be visualized by magnetic resonance imaging (MRI). The dextrin coated spions have been used in vitro and in vivo as MRI contrast agents. They can be targeted by applying an external magnetic field or by functionalization with specific ligands. The efficient coupling to antibodies has provided localization in specific tumor models in vivo. The spions, encapsulated within a polyacrylamide matrix and functionalized polyethylene glycol, have been efficiently uptaken by tumor cells. Now let's discuss a few nano devices which have been used for based on these nanoparticles, constructed with the help of these nanoparticles, and which are applied successfully in your cancer diagnosis based on the nanotechnology. One major application is a nanoscale cantilevers. Now, cantilevers are constructed as part of a larger diagnostic device. These can provide rapid and selective detection of cancer related molecules. Let's have a look into the cantilever. So, this is a cantilever structure. This is a part of a larger device. Now, these cantilevers, we can observe from this image how cancer cells, there are biomarkers, the substances or the cell surface markers which are present on the cancer cell. These are the molecules which are identified by the antibodies which are present on the cantilevers. The cantilevers, as we were discussing, are constructed as parts of a larger diagnostic device and can provide the rapid detection. So, the cancer specific molecule bind to the molecules that act as sensors. The binding of a cancer molecule causes the sensor to change conformational shape. This movement is exaggerated as a sensor molecule acts like a single lever cantilever bridge. Another interesting nano device is a nanopore. This is a schematic illustration which depicts the nanopore on a nano device. Okay. So the single stranded DNA molecule passes through, which is read by the system, and it detects a minute changes in the DNA. So this helps us the earliest detection of the cancer. As DNA passes through a nanopore, the scientists can monitor the shape, the electrical properties of each base on the strand. Because these properties are unique for each of the four bases that can make up the genetic code, scientists can use the passage of DNA through a nanopore to decipher the encoded information, including the errors in the code known to be associated with the cancer. Another nano device is your DNA coated gold nanoparticles, which forms the basis of a system that also uses larger magnetic microparticles to detect femtomolar concentration of the serum proteins. So, in this study, let us talk about a case study wherein a monoclonal antibody to prostate specific antigen, here referred to as PSC, is attached to the magnetic microparticle, that is MMP, creating a reagent to capture free PSA. A second antibody to the PSA is attached to the nanoparticle, and the two particles create a sandwich of the captured protein, which can be easily separated using a magnetic field. So, here we are constructing a nanoparticle which is specific to the free PSA. Similarly, a magnetic microparticle is also created, which is again specific to the free PSA. Now, these two will bind to the PSA such that it is now creating a sandwich. Now, later we separate this magnetic microparticles by means of the magnetic field. The barcode can then be amplified using PCR, that is the bound PSA from this. This technique has a potential to quantify an antigen at concentrations that would not be possible even to be detected by the conventional ELISA. So this is a schematic illustration showing you the process. So here the first step we can find out the target protein is going to capture with the micromagnetic particles, MMP probes, right? So this binds, the target protein is your PSA, right? So your MMP goes and binds to it. And the step 2, a sandwich is done. How is it done? It is done with another nanoparticle. Okay, so the 13 nanometer NP for biobarcode PCR, right? So this comes and binds to the target protein. So the target protein is now sandwiched between the MMP and the NP. In the step 3, the MMP probe is separated by means of your magnetic field, external magnetic field which is applied. Now the biobarcode DNA is separated from the nanoparticle. So this can either undergo a PCR so that it can be done with a chip-based detection of the biobarcode DNA for protein identification, or we can also go in for PCR-less detection or the biobarcode from the nanoparticles. This is one of the study which have been used for detection of your diagnosis of your cancer cells. To summarize, the nanoparticles can be used for diagnosis of cancer in these ways: for in vivo tumor imaging, detection of the biomarkers, and based on the cell surface proteins. So the detection of biomarkers means the proteins, the circulating tumor cells as such, the microRNA or the extracellular vesicles which are secreted from the cancer cells. And they can also be detected based on the cell surface proteins like the mRNA and also from the circulating tumor cells. And they can also be used as a in vivo imaging agents either by active targeting or passive targeting. So we have summarized and we have seen the various, to summarize, in summary, we have seen the types of organic and inorganic nanoparticles and their application in the cancer diagnosis, either for vivo imaging or for detection of the biomarkers. We also found few nano devices based on the nanoparticles like a cantilever bioassays which can be used for detection of the cancer cells. With this, we conclude the session, and I'll be back soon with another session on the use of these nanoparticles for cancer therapy. Thank you.